How are you?
Doing all right, thank you.
My name's Joey. I'll be your nurse today.
Perfect.
I'll get some hand hygiene going on. What's your name?
Nick,
When's your birthday?
May 26,
I'm
1994.
going to go ahead and look at his wrist braces. I see that that is correct. I'm going to be doing a head-to-toe assessment on you today. Is that going to be all right with you?
Yep.
Question more fast. Do you have any allergies that need to be aware of?
Nope.
Are you in any pain today?
Nope.
If he was in pain, I would do his pain on a 0 to 10 scale. Since he's not, we can go ahead and move past that. So we're going to go ahead and start the physical assessment. I'm first going to do our general survey. I'm going to look at his body structure, make sure that he looks symmetrical. Everything appears to be normal for his body. His facial expressions seem to be good. Facial movement's fine. His mood was well when I asked him. He smiled, so I know that he can move his face. And appears to be well dressed, clean, dressed appropriately for the event that we're in right now. So that's good. How old are you, sir?
I am 27.
And how much do you weigh?
275.
And how tall are you?
I am 5'11".
Okay, so judging by his BMI, I would put in that he is overweight. So we'll work on that. When he walked into the office today, I saw his gait. He didn't appear to be struggling, stumbling. Didn't appear to have any issues with his gait, so I feel that his gait is going to be okay. You said your name earlier was Nick. Do you know what day of the week it is?
It's Tuesday.
And do you know where you are?
I'm at the hospital.
And do you know why you're here?
For a physical assessment.
Okay, so is any thumbs for based on those questions? So we're going to go ahead and start the assessment. I'm going to go ahead and first look at his head. I'm going to go ahead and touch his head. His head doesn't feel it feels to be normal, and he has a full head of hair. Hair is soft, well distributed. Just looking at his head in general, appears to be normal size for his body. There are no lesions noted, and position midline on top of his neck. And so I'm going to go ahead and look at his skin and his just evaluate everything real fast. He doesn't appear to have any lesions on his arms. I'm going to look at his back. Doesn't appear to have any lesions there. No tattoos, no rashes, or anything worth knowing there. I'm going to go feel the temperature of his skin with the back of my hands. It feels normal and dry, and how it normally should. I'm going to go ahead and look at his nails now. Going to do a normal contour, normal color, pink. The shape is normal, no clubbing noted on his fingernails. I'm going to go ahead and do his capillary refill, which is going to be less than 3 seconds. So that appears to be good to go. Now that we did that, I'm going to go ahead and do his pulses on his radial pulses on his wrist. So I'm going to go ahead and feel these for 30 seconds, multiply the number by 2, and that would be his pulse. And on top of that, it currently feels at a +2 and bounding. So that's good. Now we're going to go ahead and jump to his eyes. His eyes are going. I'm going to go ahead and sorry, my little thing. Sorry. First, I'm going to look at his eyebrows, eyelashes, eyelids. All appear to be full and normal and symmetrical. Noting any lesions on any of those. I'm going to go ahead and look at the sclera of his eyes. That appears to be white. His eyes appear to be blue in color. So we're going to go ahead and do a vision test real fast. I'm going to go ahead and just look straight at me, please. I'm going to go ahead and look at your pupils. Pupils are equal, round, reactive to light on both. I'm going to go ahead and test your vision field. So you're going to want to follow my pen. It's going to go up, down, over. Okay, so, and then we're just following pen light. So he's accommodated to both light and movement. I'm then going to go ahead and look at his ears. I'm going to go ahead and feel any pain at all in your ears?
Nope.
Do you have any hearing issues that I need to be aware of?
Nope.
Any hearing aids?
Nope.
No? I'm going to go ahead and examine his ears. I'm going to go ahead and look at those. I'm not noticing any lesions. They appear to be symmetrical and how they should be placed upon his head. I noticed that. I'm just going to go ahead and check his hearing real fast by doing a whisper test. Please repeat these past, these whatever you hear from me say.
1, 2, 3. 4, 5, 6.
Okay. I noted any hearing loss, and once again, I also didn't note any hearing aids. So he's finally there. I'm going to go ahead and now go to his nose. Nose appears to be midline on his body, appropriately sized for his face. And do you have any nasal septum issues that I need to be aware of?
Nope.
No? Can you go ahead and take a deep breath through your nose? Awesome, thank you so much. Nose is patent. I'm going to go ahead and look inside his nose, looking for any lesions, any drainage. He does not appear to have any, so he's good to go there. I'm going to go ahead and jump to his mouth now. If you wouldn't mind opening your mouth, I'm going to take a little look. First looking at his lips, teeth, and gums, noting for any dryness, cracking, which I'm not noticing any of that. They do appear to have moisture, so he's good there. So I'm going to go ahead and look inside your mouth. Look at his teeth alignment, gums and tongue. All of that appear to be normal. I'm not noticing any cavities or caries that he has had. If you mind opening your mouth and I'm going to look at his uvula. Look at his uvula. Looks to be normal. I'm not noticing any odor coming from there. If you wouldn't mind smiling. Showing his teeth. Awesome. See his good facial movement there. No deficits noted with that. And I think that's going to be good for there. So now we're going to go to look at his throat. I'm going to look at his trachea. Trachea appears to be midline, no deviation. If you wouldn't mind moving your head to the left, to the right, to the back, to the front. Is there any pain there at all?
No.
Cool. Alright, so now we're going to go ahead and move on to the upper extremities. I'm going to go ahead and feel each upper extremity. Do you have any pain at all there?
Nope.
And any pain at all here?
Nope.
Okay. Go ahead and feel the back first. For temperature-wise, temperature feels normal. Do you have any pain? And the skin feels normal color. Normal texture. Moisture level. His skin feels to be pink. So we're going to go ahead and look at your hands. If you wouldn't mind just taking your hands and going up, going down, side, down, up, and down. Do you have any issues with your fingers, joints?
No.
No? Cool. So we're going to test the range of motion. Just go up, and down, and back, and then up, and down, and back. Any pain there at all?
No.
Okay. Those were okay. So if you mind, I'm going to test your strength. So just please try and push your hands up. All right, awesome. Now I'm trying to bring them down. Good job. Now try and push them out. Now try and push them back in. Awesome. Good job. So his strength appears to be all intact. We're going to go ahead and jump to the respiratory assessment of the patient. As I've been evaluating him the entire time, I've been looking for any respiratory stress, any respiratory issues such as accessory muscles, which I haven't noticed. Mr. Nick, are you having any problems breathing right now?
No.
Awesome. We're going to go ahead and do a little listen to your chest real fast, all the areas of the lungs. I'm going to go ahead and clean my stethoscope off with my alcohol wipe. Let that air dry before I touch my patient with it. So I'm going to go ahead and listen. Take a deep breath. Awesome. Take a deep breath. Awesome. And then for a minute, I'm tucking your shirt for me. Thank you. Go ahead, listen. Go ahead, listen. Go ahead, listen. Go ahead, listen. Okay. Now listen to his sides. Good. Listen to this side. Okay, so now we're going to go ahead and listen to the back real fast. Go underneath your shirt, sir. So go ahead and take a deep breath. 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 I would be evaluating these breaths for a full breath cycle just to make sure that everything is appropriate. I have not heard any wheezing, crackles. Patient is not complaining of any shortness of breath, so he appears to be breathing fine. When listening to his chest, I didn't know any lesions. There was symmetry with the movements of his chest. So now we're going to go ahead and to assess the trachea. I'm sorry, not trachea. The cardiac. First of all, I'm going to go ahead and feel for his cardiac pulses. Once again, feeling for 30 seconds. Times by two. Times by two. To me, his pulse. We'll also be looking for amplitude, which key currently is +2. So now I'm going to go ahead and evaluate his 5 heart sounds. The 8 first is going to be his aortic, and to the right of his second intercostal space, to the right of his sternum. Then his pulmonic, which is going to be to the left of his sternum, second intercostal space. Then I'm going to go ahead and listen to the herbs point, which is going to be at the third intercostal space to the left of the sternum. And then I'm going to go ahead and listen to the tricuspid on the fourth intercostal space, right to the left of the sternum. And then his midclavicular fifth intercostal space for his point of maximum impulse, his mitral valve. I would listen to that for a full minute to ascertain what that pulse is. So now that I have done that, we're going to move to the gastrointestinal. So maybe you mind laying back. Are you currently having any abdominal pain that I may be aware of?
No.
And what was that something that you avoided and or had about movement?
2 hours ago.
Awesome. So first I'm going to just inspect his abdomen for the contour, which appears to be normal. The shape also appears to be normal for him. Not knowing any lesions. Skin appears to be normal color. I'm going to go ahead and listen to his bowel sounds before I do anything else. Each bowel sound I would listen to for a minute to ascertain it. I do all 4 quadrants, here, here, and here. I would note that he did have normal bowel sounds or ups bowel sounds and take a few measures for all of those. After I went ahead and listened, I'm going to go ahead and feel for any tenderness, rigidity, rebound tenderness, guarding or anything to that such. Doing any pain at all? Does this hurt you?
No.
Okay. I'm not noting any pain. Once again, not noting any lesions on the patient. So now that's done, we can go ahead and have him sit up. Now we're going to move on to the lower extremities. I would go ahead and feel each lower extremity through how he stands up, noting for any skin lesions, symmetry about his legs, any feeling with the back of my hands for temperature. Feels normal, dry. Skin color is appropriate. I would want to go ahead and assess for his strength. So if you wouldn't mind lifting your leg up. All right, now pull it down. Okay, lift it up. Now pull it down. Oh, yeah. I'm gonna go ahead and push him out. All right, now put him back in. All right, good. So go ahead and take your right leg and just extend your knee up. Okay. Now we're also gonna do your foot wires up here. Do here, 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 and here, and just go around. All right. So next leg, we're gonna go up. We're gonna flex foot up, down, left, right, and around. So doing range of motion there. I'm going to go ahead and assess for his pedal pulses. I would do this for 30 seconds and times the number by 2 to get the pulse. Right now I would also assess for his amplitude which is currently +2. Now that we've done that, we are gonna go ahead and wrap up. I'm gonna go have my patient lay back into bed. I'm gonna lower it to the lowest position and make sure the bed's locked. I am going to put his call light in reach for him. Gonna go ahead and wash my hands and ask the patient, is there anything else I can possibly do for him? So is there anything else I can possibly do for you?
Not this time.
Okay, now that I wash my hands, I am good to go and we'll end my physical assessment. Thank you.